I am Dr. Pat Thompson, the director of the Family Nurse Practitioner Program, the BSN to DNP program at Northwestern. And I have today with me Lindsay Garinger. She is a family nurse practitioner at the Enid office of Great Salt Plains Health Center, and she earned a BSN in Northwestern and an MSN as a family nurse practitioner at South University. So we're going to ask Lindsay some questions today about her journey to become a family nurse practitioner. Lindsay, tell me a little bit about your practice setting and what types of patients you have.
So Great Salt Plains Health Center is a federally qualified healthcare center, and we see everybody, all ages, races, and populations, whether they have insurance or not. And we are family practice, but we also have other services available to us, like we have dentistry, and we also have a women's health and a psychiatric nurse practitioner also. And we see a whole lot of patients in a day. We see a variety of things, just what you would expect in a family practice setting.
What about your career as an RN prior to going to school to become a family nurse practitioner? Do you feel prepared you for this role? And why did you decide to become a family nurse practitioner?
I always wanted to become a family nurse practitioner whenever I was in nursing school. That's kind of one of my long-term goals. Was I wanted to get experience as a nurse, and then kind of, as I got my family and was working as an RN, I was able to feel confident enough that I would be able to advance my education. And so I was able to do that. I worked at St. Mary's, and I worked ICU, the PCCU, I did labor and delivery. I worked all over the place there, the resource pool. And so I was able to get all kinds of experience there. I also worked in home health care, which surprisingly helped me quite a bit and prepare me for my education for this.
Great. What are the positives and negatives about this position in terms of the things that make you smile and then the things that are really frustrating as a family nurse practitioner?
Well, just like being a nurse altogether, it's the most rewarding thing that I've ever imagined doing. I can't see myself doing anything else, and it's just very rewarding. I love my patients. It's great to see what you're doing for them each time they come in and they're doing better. And it's just, would be the most positive. Also, the relationships that you build with people, your colleagues, and you learn something every day.
Great. Any negatives? Because I know in my job as a family nurse practitioner, there are some seriously long hours.
Oh, yeah. Luckily, I work 4 10-hour shifts a day. I don't have any night shifts or anything like that in the setting that I work in. So I really love that. But a negative would be the financial strains our patients have. There's barriers to access to care as far as they can come here, but where can we send them if they don't have insurance? That's one of the biggest things, not about being a nurse practitioner, but in healthcare overall, I'm sure. But that is a big negative because it kind of gets you down that you're trying to help them and you're guarded, like you're blocked. It's like a roadblock. And so it's kind of difficult, but that's one of the challenges that we face, and we get through it and make it work.
That sounds good. And lastly, what advice do you have for somebody who's thinking about going into a graduate program to be a family nurse practitioner in terms of work-life balance and the amount of study as compared to maybe in their BSN program, and also the lifelong learning that I feel is probably in excess of what as an RN I really had to engage in. It's just a continual battle to keep up with the latest to be a competent practitioner. Tips for prospective applicants.
Well, first of all, if you thought nursing school was hard, nurse practitioner school is much harder. And you feel like you're prepared, you don't really know what to expect as you dive into it. You're going to have times when it's, like I said, if I would have known how hard this was going to be, juggling my nurse job, my family, I had a baby in the middle of my program, things like that. You don't realize how hard it's going to be. So you need support. Support is a huge factor in your success of being a nurse practitioner or going to school successfully. You have to take considerations like who's going to take care of your kids, because you're going to be studying a lot, and you need the support from your kids, your husband, your family, financial support. You're not going to be able to work full time most likely. If you do, you're Wonder Woman or man or whatever. But whenever you are doing clinicals and you're studying, you have the didactic and you have the clinical. It's very difficult to juggle all those things together. But if you are determined to make it work and you have the support, then you'll be successful. I do think that whenever you compare the nurse practitioner program to a BSN program, you have to have your experience as a nurse, like you're starting from scratch with the BSN, and you have to have that foundation as a nurse and have a variety of, I feel like you need a lot of experience. You need a couple of years experience and try different areas of nursing, and so that you can use all of that, because I use my experience that I had as a nurse every day. I feel like that's really important.
I think that's great advice. Well, Lindsay, any final thoughts?
Well, I have precepted a lot of the students from Northwestern. I've really enjoyed it. I think it's a great program. I think that you just need to be prepared if you are considering getting into the program, and just knowing that you have that support in all different ways, and be determined to be successful. Another thing I think is don't be too hard on yourself. But I think it's a great program.
Thank you very much for your time, Lindsay.